Hi, my name is Nurse Jordan, and I work at the Wake County Sheriff's Office in the medical division. I had worked as a nurse in several other areas, hospital, home health. This was the place where I felt like I could really put down some roots. Here I am working toward year number 22, December 1st. I love my coworkers. We've always had a really tight-knit group of nurses that have worked here, and it's really good to have that type of friendship and feeling of family. My favorite thing about working here is the autonomy. I get a chance to work in any area here. I can do medications, I can work in the clinic, I can work in the intake area where I'm pretty much an assessment nurse. It's really varied, the things that I get to do, and I like staying on top of my knowledge that I've already gained and learning new things all the time. Sometimes when you work in a hospital, you kind of forget how to do things because you're not used to doing them regularly. But here you can get called on to do a blood draw 24 hours out of the day, every single day of the week. So you have to stay sharp. You have to know your stuff. The main question I get asked working here is, do you feel safe? Yes, I do feel safe. We have our officers. We have someone with us all the time, whether it's in the dorm or whether we're in the clinic area. Being here is a more transient population, meaning that they come and go. Now they may turn around and come right back, but hey, that's how you build relationships. That's how you build patient trust. You can also establish a continuity of care with that person. If they have a chronic illness, you can make sure that they go to their appointments, that they get their medication. It's something that sometimes our population doesn't get on the outside, and I feel proud that I can be a part of their sometimes first point of contact with their medical care. I love that. One of the things I'd like for people to know before they apply here as a nurse is that you still are gonna work a 12-hour shift, but you're not ripping and running like you would be in a hospital. We're all work together as a team to get the job done by the end of the day. And it's not so much a physical job, it's more mentally challenging, which I like. It's because you get to use your thinking cap. You get to stay on top of your skills. Thanks for joining me on the go with WCSO.